Hi, my name is Brett Ballesteros, and I'm here today to talk to you about a blood disorder called ITP. ITP stands for Idiopathic Thrombocytopenic Purpura. ITP is a disorder in which, for an unknown reason, your body attacks its platelets. The reason I decided to study this disease was because 5 years ago, my sister was diagnosed with it. I thought it would be very interesting to learn more about her disease and how I could potentially help out her and help out others. Let's first take a look at platelets. Platelets are one of the most important elements in your blood. Usually, the platelet count in your blood is anywhere from 130,000 to 400,000 microliter. Platelets have many functions, but most importantly, they are involved with the stopping of blood loss by clotting. When you start to bleed, your body performs 3 steps to stop the bleeding. These steps are vascular spasm, platelet plug formation, and coagulation. Vascular spasm is a quick constriction of the blood vessel. Platelet plug formation is when platelets go to the exposed collagen fibers of the broken vessel wall. Blood clotting is when your platelets form a barrier and it gives the broken vessel time to repair itself. Without platelets, one could bleed to death because wounds would not clog up. Now let's take a look at ITP. ITP is a blood disorder in which the person has an unusual low platelet count in the blood. As I said in the last slide, the normal amount is considered to be anywhere between 130,000 to 400,000 per microliter. For a physician to diagnose a person with ITP, the patient must consistently show low platelet counts. Though having a low platelet count is dangerous, it is not considered a medical emergency until the person reaches below 20,000 platelets. In our body produces antibodies that are only supposed to react with foreign antigens. In someone who suffers from ITP, for some unknown reason, the antibodies that are supposed to protect us react with the platelets, which lead to their destruction in the spleen. Thus, will lead to the drop in platelet levels. The low platelet count will cause the individual to have very severe bleeding because of the inability to clot blood. Now let's take a look at some signs and symptoms. It is hard for us to tell if we have signs and symptoms for this condition because we will feel perfectly normal. That is why it is important to maintain a regular blood test history. It is hard for the average person to tell if they are bruising easier or bleeding more because it seems perfectly normal to them. This picture shows an example of purpura, or more commonly known as bruising. Very easy bruising is very common in people who suffer from ITP. Lastly, let's look at treatment for this condition. Usually a person will have no treatment for this disorder until their count is below 20,000 platelets. Some of the treatments include injections of high dose of gamma globin, drugs that suppress the immune system, drugs that filter out antibodies, and anti-RHD therapy. In more severe cases, treatments such as a splenectomy or a platelet injection may be used. A splenectomy may be used because usually the platelets are destroyed in the spleen. Thus, taking out the spleen will stop the destruction of the platelets. A platelet injection is not sufficient though, because just like your own platelets, the new platelets will be destroyed by your body. Thank you for taking the time to watch my video. Hopefully you learned something from it. If you would like to continue to learn more about ITP or donate money to further research of this condition, please visit the link on the following slide. Thank you.